Hello, I'm Dr. Dawn Harper. I'm an NHS GP and I'm really excited to be working with Stay Sure Wellbeing and talking to you about all the things that concern you medically. We're going to be providing a series of videos for you, and I thought we'd kick off with coronavirus because it's something that is very much on everyone's mind. I know there's a lot of concern and anxiety out there, but there's also an awful lot of misinformation, so I'd like to take this opportunity to put the record straight. But of course, going forward, I'd really like to address whatever it is that you are concerned about. So please do message me and tell me the topics that you would like me to cover. So let's start with coronavirus and what we do know about it. And of course, we're on a very steep learning curve. We didn't know about this virus 4 months ago. It's a new virus, and we are learning very rapidly about it. What we are starting to realise is that there is a huge spectrum of illness associated with the virus. And when we saw people unwell in the cruise ships and then started to test everybody, we realised that actually some people have no symptoms at all. And of course the headlines are full of people who are critically ill, and some, well, far too many, who have actually lost their lives to this disease. So there is a huge variation of symptomatology and a bit of a lottery as to what each individual might experience, although we do obviously know that certain individuals are more at risk, and the older and the frail with pre-existing conditions are definitely more at risk, and those who have a compromised immune system who have been asked to shield, and I will come back to shielding and explain what I mean by that in a moment. What we think, the norm, what usually happens is that people will contract the virus, and within 5 to 7 days, if they're going to develop symptoms, will start to get symptoms. The most common symptoms are a temperature over 37.8 degrees centigrade and or a dry cough. And those are the symptoms that we are being advised to assume are coronavirus and to make us self-isolate. But increasingly, we are realising that there are some other what we call atypical presentations. So we are noticing significant numbers of people who present telling us that they have a loss of sense of taste or smell. According to the different studies, there could be anything between 10 and 50% of people who are describing some gastrointestinal symptoms, so quite often diarrhoea. Some people are getting rashes. I think one of the very common things is a feeling of utter fatigue, and that can persist. But for most people, the symptoms get worse over about 5 days and then start to resolve. And by day 7, most people are feeling symptom-free, other than often feeling a degree of that sort of thing that most of us will recognise after a viral infection, where you just feel a bit steamrollered and washed out. Some people do have persistent symptoms, and a dry cough is one of those things that does seem to carry on a little bit. And when we talk about, and I'm going to explain what I mean by self-isolation, I will come back to that, but a dry cough is so common that we realise that most people, even with the cough, are no longer infectious and so not a risk to others and can still go out. So a huge variation in disease, and unfortunately some people at the end of that first week will get worse, and of those that do, we tend to see that they get worse over a week or so, and those that then need intensive care are often needing intensive care for 7 to 10 days, and of course then some people die. And that's one of the reasons why we are just seeing the benefits of the lockdown, because of course we were locked down on the 23rd of March, and at that point, if you had only just contracted the virus, you wouldn't really necessarily get symptoms until the 30th, and then you might have symptoms for a week, which takes you to the 7th, and then if you're going to get worse again, that takes you to the 14th, and so on and so it goes. And so this is why we're only now seeing that reduction in the new instances, new cases, and sadly the number of deaths, but they're coming down, which is a good thing. So what does lockdown mean, and what all the terms mean, right? The evidence behind social distancing is really very strong. So if you have 2 meters between you and another person, then if that person coughs, the amount of virus still in the air by the time it gets to you is minimal. So that 2 meters is absolutely critical. The hand washing is critical. The virus is killed by washing your hands with warm soapy water for 20 seconds. So really, we should all, whenever we go out and come back in, whenever we're opening any packaging, always wash our hands. That's really critical. What we're saying to people at the moment is that if you have symptoms, you must stay indoors completely for 7 days. And we're also saying that anyone you live with has to stay indoors for 14 days. And that might seem a bit counterintuitive. Why is the person who's feeling well having to stay in for longer? But the thinking is back to what I've just explained about the incubation period. So say, for example, I become symptomatic on day 1 and I self-isolate, I stay indoors until day 7, and then I feel completely well so I can go out. But say I live with 3 other people and one of those other people becomes unwell at day 7, so it's taken them 7 days to incubate the virus and show symptoms. They must stay inside for another 7 days. Now, if somebody becomes unwell, let's say on day 12 from day 1 of my illness, then they must self-isolate again for further 7 days, so effectively for 19 days. So it does get complicated, but it is really important that we adhere to those rules. One of the things that we know is that when we first identified this virus, it was thought that each infected person was probably responsible for infecting 2.5 others. Now, of course, that's a crazy thing to say because there's no such thing as a half a person, but statistically, we were infecting 2 to 3 other people. Now, over a course of 30 days, that would mean that one person would infect 2.5, and each 2.5 of those would infect 2.5, and each 2.5 of those would infect 2.5, and so it goes on. So that over a period of 30 days, one individual could be responsible for infecting 400 people. Now, if we can reduce that transmission rate to, let's say, 1.5, then over a 30-day period, that one person would only be responsible for 14 other infections. And straight away, you can begin to understand the rationale of lockdown. If we reduce the transmission, if we reduce the human contact, we can massively reduce the amount of infections that we're seeing. And thankfully, it is starting to work. Now, some of you may have also received a letter called a shielding letter. 1.5 million people in the UK received a shielding letter asking them to stay indoors completely for 12 weeks. That's a huge ask, and certainly puts a lot of pressure on an individual, and there's a lot of volunteers coming around offering help for those people, but it's a big ask to stay indoors for 12 weeks. The people that got those letters are those who've been identified as most at risk. So if you have a compromised immune system, if, for example, you have had a transplant and you are on transplant drugs, if you're on chemotherapy, those sorts of things mean that your immune system simply isn't as robust, and you could be significantly at a higher risk of much more severe infection. And so we are asking those people to shield. Those letters were sent out centrally, and what we've been doing in my practice is also going through our list of patients and just making sure that everybody that we think should be on that list is on that list. Because being on that list actually does give you some benefits. I hear all the time from people how incredibly difficult it is to get an online shopping order, for example. And if you have a shielding letter, then you will be given priority. So if you think that you could be on that list but haven't received that letter, then please do pick the phone up and speak to your doctor and just ask them, because they have the ability to add you to that list if it's appropriate. And I know a lot of people terribly worried about the fact that surgery doors are closed, but we are still very much open for business. The reason the doors are locked is to try to reduce the footfall through the surgery, and that really is simply to try and reduce transmission of the illness. But we are still very much at the coalface there for you. We are doing an awful lot more consultations behind closed doors and on the telephone. And in fact, in my surgery, I'm doing consultations in the car park sometimes if needs be, because we know the virus transmits less well outside. But if you have any doubts, your doctor or your practice nurse very much are still there and welcoming your calls. So I'd like to go on, if I may, and just talk about some of the myths that surround coronavirus, because there are a lot of them, and a lot of these messages come by email or as Facebook posts, usually saying that they've come from a medical relative of a friend of a friend. So it would seem that they have some credence, and I have lost count of how many times these kind of emails have come into my inbox from friends and family asking me if there's any truth behind them. So I would like to just address some of those myths and explain where some of them may have come from. So let's start with, if you drink plenty of hot drinks, that will kill the virus. The virus doesn't like heat. I'm afraid to say that the virus survives very well in the human body at 37 degrees, so that simply isn't true. It's very important that you drink plenty. If you have a slight fever, we lose quite a lot of fluid even with 1 degree rise in temperature, and that can make you feel dehydrated, which leaves you often feeling headachy and lethargic and with poor concentration. And of course, all those things make any kind of viral infection feel worse. So it's important you drink plenty, but I'm afraid hot drinks won't cut the mustard with coronavirus. Neither will drinking water every 15 minutes, which is one of the things that has also been bandied around. The theory behind that one being that if you drink plenty regularly, you will wash the virus down into the stomach. The stomach has very strong acid. Actually, the pH of the stomach is the same as battery acid, and that the acid will kill off the virus. I'm afraid that the larynx separates into the trachea, the tube going down into the lungs, and the esophagus, the gullet going down into the stomach, very high up. And the virus can make its way down into the lungs, which is where it causes a lot of its damage very quickly. So important that you drink plenty, and I guess that's probably slightly where this myth has come from, the importance of drinking plenty when you're unwell with any infection, but it won't protect you from contracting the virus. And on that point of drinking plenty, I'm often asked how much is plenty, how much is enough? And of course it depends on how active you are, your body temperature, and the outside ambient temperature. So what I say is don't get too hung up. A lot of the time you hear people talk about 8 glasses of water a day, but nobody really tells you what size those glasses should be. The way to check whether you're drinking enough is just to get into the habit of looking at your wee. It should be straw coloured or champagne coloured. If it's darker than that, then you are starting to get dehydrated and you need to increase the amount of fluid that you're taking. And don't wait until you're thirsty. By the time you're thirsty, that is your body's natural reflex telling you that you are already dehydrated. So going on, another one that was bandied around was if you could hold your breath for 10 seconds, then you didn't have coronavirus. Now, interestingly, with a lot of myths, there's an element of science behind them, and that's where they've got their reasoning. And we used to use a test called a Roth test when we were assessing patients over the phone, and we would ask them to take a deep breath and then count from 1 to 30 in their native tongue as fast as they could. And we timed how quickly they needed to take a breath. And there was a feeling that if you needed to take a breath in less than 8 seconds, then that was a sign that you probably didn't have enough oxygen in your blood. So it was a sign that we used to try and assess people. It's slightly fallen from favour now, but of course you can understand where this, if you can hold your breath for 10 seconds, you don't have coronavirus, might have come from. But it's simply not true. You know, please don't rely on that as a diagnostic test. Eating garlic was another. A lot of people saying to me, is it true that if I have garlic every day, I won't get coronavirus? Well, garlic does have natural immune boosting properties, and it's best if garlic is crushed. That releases that immune boosting chemical. Interestingly, heat though quite often reduces that, but to be honest with you, you would have to eat so much garlic for it to make any difference. It's a great food, it's a healthy food, it's good for your immune system, so don't stop doing it, but eating garlic is not going to protect you from coronavirus. Another one is leaving parcels outside or inside on the surface for 15 minutes. And again, I can understand that there's a bit of science behind that. So we are learning about this virus. We know that it can live longer on hard surfaces. It seems to thrive best on metal and plastic, and it survives less well on soft furnishings, things like furniture, clothing and so on. We think it can last for at least 24 hours on cardboard. So you can see where this myth has come from as well, but 15 minutes simply isn't long enough. So what I suggest, what we do in my house and what I've got my family doing, is when any parcels or post arrive, we bring it all in. We take all the outside packaging off, and then we wipe down the surfaces, disinfect the surfaces that we've unloaded the packaging in, discard all the packaging and wash our hands thoroughly before inspecting the contents, and that is something I would advise you all to do going forward. I know some people, if you've got a garage or something, have often said to the post delivery people, could you please just leave in there for me and I'll come and get it in 3 days' time. And again, that's something that you could easily do if you've got that facility. Another one, making hand sanitizers out of vodka. Well, vodka, gin, whatever you like, is about 40% proof alcohol, and hand sanitizers need to be at least 60%. So I'm sure you can all think of something better to do with your vodka and your gin. And the final one, which is actually quite a dangerous one, is people talking about the benefits of drinking silver. Now, you can buy drinkable silver, but it can do awful things to your kidneys. It can give you fits. It can turn your skin blue. Silver does have some antimicrobial properties. We use it sometimes in some dressings. So again, you can understand where this myth may have arisen from, but please don't go down that route. I hope that's helpful. If you've got other myths that you'd like me to bust or other questions you'd like me to answer around coronavirus, obviously please do message me. I hope I can help you with them.